This presentation will cover some basic nutrition management in patients with HIV and AIDS. I'm going to briefly review some pathophysiology related to HIV and AIDS, some of the epidemiology specifically related to prevalence and incidence of HIV and AIDS. Then we'll talk about how AIDS or HIV and AIDS is diagnosed and classified, and some considerations for nutrition assessment and intervention. Before we start talking about details about HIV and AIDS, I think it's important to think a little bit about exactly what it is. So remember, HIV stands for human immunodeficiency virus. So it's a disease that's only in humans, so it can only manifest itself in humans. And it's an immunodeficiency virus because it attacks our immune system. So thinking about viruses in general, keep in mind that viruses can't live on their own. Essentially, they have to hijack a healthy cell in order to live. So in HIV, the virus actually attacks some of our immune cells, specifically CD4 cells. So on this image on the page, you can see this cell is a CD4 cell, so the CD4 receptor is on the outside of the cell. The virus attaches itself to that CD4 receptor and then fuses into the cell. So essentially, HIV is a retrovirus. So this little swirly here is actually RNA, so viral RNA. So the virus doesn't actually have DNA, but it has RNA that can basically turn into or incorporate into the DNA of the cell. So basically, the virus enters the body through typically blood or some body fluids, attaches to the CD4 receptor, fuses into the cell, and then that viral RNA uses reverse transcriptase, which is part of the virus, to make cDNA, which is essentially a one-stranded DNA. Here you see, and then that copies itself into a double-stranded DNA, which then can be incorporated into the DNA of that cell. So remember, this part here is representing the DNA for that whole cell. So remember, in the nucleus of every cell in our body, it has the entire DNA for that human being. And so this is in the CD4 cell is the DNA, and that HIV incorporates itself. So essentially what happens then is when that cell replicates, the HIV virus maintains in that cell and goes into new cells. So really how HIV works is that it incorporates itself into the cell. It can maintain latent for a while because we know that DNA isn't always being expressed, or every portion of DNA isn't always being expressed. So even if this HIV virus is incorporated into a CD4 cell, it doesn't mean that it's constantly necessarily going to be expressed. So that's why there's kind of different stages, or people have different progression rates in how quickly the HIV progresses in their body. It can vary. So essentially then, once it does become active, it destroys the CD4 cell and then goes on, it continues to replicate more CD4 cells that have this HIV virus in the DNA, and so it continues to destroy these CD4 cells or immune cells. So that's why HIV is an immunodeficiency disease, because it basically hijacks a type of immune cell and then destroys them, so that reduces our body's ability to fight off diseases. And so it reduces our immune system. So HIV is a virus that our body is not able to combat. It's not able to totally kill it. So we'll look at that in just a little more detail as well. This is just an image that kind of, the first part reminds us about the fact that HIV only infects humans. And then in terms of the transition from HIV to AIDS, so HIV is when a person's infected and that HIV attacks your T cells, which the CD4 cells that we just talked about are a type of T cell, and as we just talked about, uses them to make copies of itself. So it sort of hijacks those cells, incorporates into the DNA so that it can continue to replicate. So basically, AIDS is it's diagnosed as AIDS when the HIV destroys a lot of the cells. So basically, as the disease progresses to a certain level of severity, when there's a certain amount of cells that have been attacked, then that is what is considered AIDS. So it's basically just a progression of the HIV virus. When we look at some of the epidemiology or statistics related to HIV and AIDS, it's a huge issue worldwide. Certainly there's a problem with this in the United States, and we'll look specifically at the United States, but this gives some information on the global epidemic. So as you're probably aware, countries such as Africa have a huge problem with HIV, including in children. So you see some numbers here that are really quite staggering in terms of the number of people who are infected with HIV and we continue to have new infections diagnosed, and then of course the death from AIDS at the bottom there. So really a significant problem worldwide. This slide is from the CDC and shows rates of diagnosis of HIV among adults and adolescents in the United States. So each of these numbers on here represent the number of cases diagnosed per 100,000 people in the population of those states. So just to kind of give you, sort of a sense to look at that, the website where this came from is linked at the bottom of the slide, and that's a terrific website for a lot more detailed information if you would like, in terms of various aspects of diagnosis, different ethnic groups, genders, all sorts of different ways to look at the issue of HIV and AIDS in the United States. So how is HIV diagnosed and classified? First of all, the diagnosis really is done based on the presence of an antibody. So our body attempting to produce something against this, HIV, we can't really fight it, but so basically detecting that virus in the body. And then there's different classifications of HIV to kind of show how severe the disease has progressed. And as I mentioned, then when it gets to a certain level of severity, that's when it is diagnosed as AIDS. So primarily classification is done by either both really, CD4 count and clinical characteristics. So remember that HIV attacks those CD4 cells and destroys them. So as that CD4 count goes lower and lower, that's a more progressive, the disease has progressed further. And then also clinical characteristics are looked at, a variety of what physically is going on with the person. So there's different ways to kind of classify the severity of the disease. In terms of medical treatment, it's important to realize that there is no cure for HIV. So really the focus of medical care, or the primary goal, first is to decrease the viral load. So antiretroviral therapy is used. Remember we said HIV is a retrovirus, so it's antiretroviral therapy, trying to attack that virus to some extent and decrease how much of the virus is in the body. Doesn't mean it will get rid of it entirely, but to hopefully get that as low as possible. The second piece is really to either prevent or rapidly treat what's called opportunistic infections. So because HIV attacks our immune system, the immune system is compromised in patients with HIV, and so they are much more likely to get other types of infections. So a big goal of medical treatment is to either prevent those infections, or if the patient gets some kind of infection, to treat it as rapidly as possible so it doesn't progress. And then maximize nutritional status. We'll talk about nutrition in a little more detail, but it is important to recognize that nutrition is a key element of HIV treatment. It's important that the patients with HIV maintain good nutritional status in order to be best situated to fight off opportunistic infections and those types of things. So we'll look at that in a little more detail. When we think about some of the key nutrition concerns, there's a variety of factors to consider. One factor is that HIV there's a catabolic nature to the disease. So because, again, remember that it's a virus, it creates an inflammatory process in the body. So some of the nutrition factors that we think about with inflammation happen with HIV as well. So that includes things like muscle wasting, and those sorts of factors, increased metabolic needs, increased micronutrient needs. So it's important to kind of remember that at the heart of HIV, there really is a catabolic nature to the disease. Another huge factor is that the medications used for the management of HIV are significant, and many of them have nutritional side effects, meaning things like nausea, vomiting, diarrhea, decreased appetite. So all of those things need to be considered when you think about the nutrition treatment for people with HIV or AIDS. Lipodystrophy is when the fat in the body sort of redistributes. So it really moves to more central obesity, so loss of fat in other parts of the body sometimes, and increased fat in the central region. So that kind of happens independent of necessarily a different caloric intake or a different composition to the diet, but it can be a significant factor. As we know, that central obesity, or the fat that's in the central region, is more dangerous from a health perspective. So then we need to consider things like insulin resistance, cardiovascular disease risk. So that shift in the distribution of the fat is a nutrition concern. Another huge area is foodborne illness and food safety. As we talked about, because HIV attacks the immune system, people with HIV are immunocompromised. They aren't able to fight off bacteria and other viruses easily. So when we think about food, one key aspect is to make sure that the patient is aware of safe food handling procedures so they don't get infected with a foodborne illness that they might not be able to fight off as easily as someone with a fully functioning immune system. The last bullet I have on here is social, economic, and environmental issues. I think this is true with every health concern out there. However, there may be some things that are unique to HIV. There's a stigma often associated with HIV and AIDS, so that can create some social types of issues. Sometimes there's economic issues, particularly any disease that causes illness to the point that maybe someone can't work as much. They may have a loss of income from that, so certainly something to consider. And then any environmental issues, again, some of this related to perhaps stigma associated with the disease, support systems, perhaps some of their support systems that were there are no longer there after the diagnosis, those types of things. So just really, again, I think it's an important area to consider with any health consideration, but particularly with HIV and AIDS, I think it's particularly important to really be aware of some of these social and environmental issues that may be coming into play. A thorough nutrition assessment is critical for patients with HIV or AIDS, and ongoing reassessment is equally important. So the various areas that you're always going to include in your nutrition assessment, but just kind of looking at some aspects particularly related to this diagnosis. In physical exam, you really want to be looking at their weight. Weight loss is a very common thing to have happen in patients with HIV, and it is connected to poorer outcomes. So it's really important that we monitor the patient's weight, and if they start losing weight, that we do something to help stop that weight loss. In addition, we want to look for muscle loss. So again, in terms of thinking about physical exam, you want to not be just looking at the number on the scale, but looking at their muscle stores in their body. And then that fat gain or fat redistribution, as we just talked about, where they may have increased central adiposity. So to really be addressing that and looking at that on the physical exam. In terms of labs, of course, there's a variety of things that can happen, but some things to be particularly mindful of. The CD4 count is something that's going to be monitored regularly in patients with HIV so that it's followed if that CD4 count is dropping, it means that the disease is progressing. So it's something that's helpful for you to be familiar with if you're working with patients with HIV and AIDS, because as their CD4 count goes down, that's going to increase their risk for infection. So things like food safety become even more important as that CD4 count goes down. You want to look at inflammatory markers. Again, HIV is an inflammatory process and stimulates an inflammatory process, so you want to look at those types of markers and consider those in your nutrition assessment. And then general malnutrition indicators, because we want to prevent malnutrition in this population as much as possible. You want to assess their diet and their food intake, any change in the quantity of food they're eating, the quality of food they're eating, or differences in food tolerances. When patients have HIV, they can commonly get sores in their mouth that can make it painful to eat certain types of food, so you want to be asking about that. That's also something that could be looked at on physical exam. If they are having pain with eating, whether it's pain in their mouth, or maybe they're having nausea, diarrhea, any sort of GI symptoms, you really want to help work through what types of foods are they going to tolerate better. So when you're doing the assessment, really looking for changes in the diet and what might be triggering those changes. So is it because they have sores in their mouth, or is it because foods are tasting different than they used to, or what's the root cause? Again, the GI symptoms are quite common, so important to ask about changes in bowel habits or any of those sorts of things. Looking at medications that they're on and medication changes is important, because again, the medications can change frequently, and many of them have nutritional side effects. So you want to be aware of what medications they're on and check out whether that particular medication might have a nutritional side effect. And then again, as I already talked about, any environmental type of issues that might interfere with their nutritional intake or nutritional status is important to consider. So when I just talked about nutrition assessment, I kind of also alluded to nutrition interventions and some of the ways to address those things that you're assessing. But essentially, you really have to customize the intervention based on their symptoms. Again, something, for example, if they have sores in their mouth, that intervention is going to be different than if they have diarrhea, perhaps. So you have to really customize based on their symptoms. Again, if they're having things like weight loss and muscle loss, you need to really look for ways to increase the caloric content. But if they're not having that issue, then you may not need to boost up the calorie intake so much. The amount of calories that a person with HIV or AIDS needs is really going to vary. Some may have not tremendously higher needs than someone without the disease. However, particularly as the disease progresses, or if they have any other types of infections, again, think about it being an inflammatory process. There may be fever associated with it. All of those things can increase calorie and fluid needs. So really looking at the patient's overall clinical status and decide whether their caloric needs are going to be higher than someone with the same height, weight, activity level who doesn't have HIV. We really want to, again, minimize the weight loss and particularly the muscle loss. So encouraging exercise is also really helpful in this area. Regular physical activity, regular movement to help preserve muscle mass. Addressing body image issues if they're present. It doesn't mean that everybody obviously is going to have body image issues, but they certainly can, particularly if they're having that lipodystrophy that shifts, ends up having more central obesity. They're losing some of that muscle mass. So be mindful that there could be some, discomfort with the changes that are happening physically in their body in terms of body image. And just, again, be mindful of it. And then food safety is a really big factor for patients with HIV and AIDS. So it's absolutely essential to talk to people about those basics of food safety, cooking food to the proper temperature, washing food, how long food can sit out on the counter or at room temperature, safe water supply depending on where the patient lives. So think of all of the things that might go into their mouth and making that safe. So whether it be water, beverages, infant formula that they're mixing, if it's a baby, all of those things that might be food safety concerns. And just general hygiene related to food. There's a wide range of what people are used to in terms of, what their own personal hygiene practices are. So, ask questions and help them figure out ways within the environment that they live in to keep foods safe. Basically, anything that goes in, we don't want to introduce any extra bacteria or things like that to someone with a compromised immune system. So, just really making sure to educate on food safety. So a quick summary of this very brief overview is that just remembering that medical treatment really focuses on slowing the progression of HIV. There is no treatment, there's no cure for the disease, but medication has come a long way in terms of really being able to keep the viral load lower and help people live longer and healthier lives. Nutrition is really a key aspect of care. So studies show that when patients, for example, lose more than 10% of their body weight, the outcomes are not as good. So it's really important to have that regular nutrition assessment and reassessment and really address things quickly as they come up. A careful nutrition assessment and individualized interventions can really help improve outcomes because everybody doesn't have the same symptoms. There are a range, and so it's important to really find out what's going on with that particular patient and then develop interventions to target that and then monitor to make sure the interventions are working or adjust as needed.